starting 哦。
we start at 10. 主要3个。
You can start now.
Yeah.
I think ask you to come. Start recording.
Yeah, starting.
Oh, start your. Okay. Alright, very good morning everyone. Alright, it's 10 o'clock. Let's start. Is that okay? Alright, okay. Thank you very much. Very good morning everyone. To our training today. The name of the training is CAHIMS Preparatory Course. I will explain more what does this course actually mean and how does it benefit all of you who are here today. Okay? So what I'm going to do is I'm going to do some ice breaking in a bit. I just want to introduce myself first. So quick up. So I just want to congratulate all of you for participating in this course because I understand that healthcare industry is actually one of the toughest industry to actually penetrate, regardless of what your positions are. If you are a salesperson, if you are pre-sales, or even if you are looking into building content even for healthcare, it's actually very, very challenging. So in healthcare, there is industry, we call it healthcare IT. So any IT related products or any IT related what we call IT related conversations on healthcare, we call it healthcare IT. So I'll go deeper into the discipline after this. Alright, so I just want to introduce myself very quickly. So some of you who have not met me or who have already met me, so I'm actually a medical doctor by profession. Why say I look young, but actually I'm quite aged. So I spent 8 years practicing as a medical doctor. So if you look at the list, most of my years I actually spent, so I finished Ministry of Health practice, did my housemanship, HKL, then I went to Bentong Hospital, I went to Ampang Hospital, then I practiced in Sunway Medical Center for a while, and then I left practice, I joined a pharmaceutical company, I did a bit of medical affairs, did a bit of pre-sales, selling drugs at the time, pharma. Then 8 years ago, I joined an EMR company. So if you are familiar with EMR, Electronic Medical Record, so it was Cerner Corporation, today is known as Oracle Health, if you have read about them. Then before I joined HIMSS, actually I was with a company called Lexmark International. Lexmark International, you all know what they do? They sell printers. So you'll be wondering, what is Jason doing in printer company? So printer company was trying to do healthcare as well. So they don't sell to B2C, they do B2B, industry based. So when they sell their solution, they sell based on manufacturing industry, healthcare industry, retail industry, supply chain industry. So I was doing the healthcare integrate, the vertical part. So they were selling business continuity planning solution using printer. So that means when the hospital IT system go down, what do they need? Paper, right? So I was selling business continuity planning solution at that time. Tell hospital that they should print when the IT system is down. So I've been doing that for many years, and of course I joined HIMSS this year. That's my QR code. LinkedIn, if you want to add me, you can add later during the break. So that's a bit of background about myself. Okay, so let me see whether I will discuss a little bit of a training objective and the outcomes. Then I would want to get to know each and every one of you. I would also want to know from you as well, what is your expectation from this training? So it's a big topic. Training objective. So at the end of this course, this training, all of you will actually gain the knowledge and the skills to actually understand and evaluate digital health solutions. Now again, digital health as a term is a big term. The term has evolved over time. So healthcare IT and mHealth, mobile health today is digital health. So at the end of the course, you will learn and be more familiar with digital health solution and how you can actually use digital health solution to improve patient safety and care in the hospitals. Now, I'm not talking that you guys are end user of it, but at least you understand what it means to implement these kind of systems in hospitals. That's the objective. Now, the outcome of this is that at the end of the training as well, what will happen here is, as you understand healthcare IT, as you understand digital health solution, you will understand that at the end of the course, when you evaluate a system, so if you are working in a hospital today, when you want to buy a system, you want to buy a solution, you are able to evaluate how to actually buy one. What is important? What is the product management life cycle of this? What is the workflow that is implemented into the solution so that the hospital will benefit from this system? So that's the whole purpose of the course today, because the hardest thing is actually to have that conversation with the hospital customer. So if you're talking to a doctor, you also need to understand a little bit how the solution will impact his day-to-day process. So if you're talking to a CFO in a hospital, you must also understand what the CFO is thinking about if they're going to buy a system, and if they are buying a system, if there's a financial component in the whole system, how would it impact the CFO's process as well? So that's the whole reason why HIMS as an organization has come up with this kind of course, because we want to prepare not only healthcare professionals, but also people in IT that are engaging healthcare customer. They understand what is important for the customer, rather than just hard selling, trying to just push the solution to them. So that is the whole outcome and the objective of this training. Okay, so I will go one round. I just want to know a little bit about yourself, so that as the training continue, I can understand what is the expectation that I should deliver to you. Okay, maybe we can start with you. You are Mr. Luis, yeah? Okay, you're from SNS as well. What is your role?
Sales.
Sales, okay. Are your customers healthcare customers?
Yes.
Okay, how is it? Is it okay?
Uh,
Tough? Not easy, yeah? Okay. Luis, yeah? Alright, Luis. Then next to you, Luis? Yeah, Mr. Ong. I call you Mr. Ong? Okay. Wow, what is your role in?
Business development.
Okay. BD, yeah? Healthcare is your portfolio also?
One of it, but not their focus yet. That's why the reason why I came in is to understand more.
Okay.
Myself to pitch to my customer.
Okay, good. Alright. Then behind Simon, yeah.
I'm under BD also.
BD also.
Actually, in fact, I have two customers, which is SUMC and also the Sunway Medical Velocity.
Okay.
In fact, I'm deal with their IT people. So one of my concern is always is SUMC, the IT people that I deal with, they ask what is the alternative, what is the product that you can sell? Because previously I supplied only iPads to them.
Hardware lah.
Hardware. And recently I do provide some MDM solution to them, but that's not enough. In fact, I want to see whether there are any other product that we can approach.
Okay.
To benefit their doctors.
Okay.
As I know they're also using some robotics
Alright.
systems to help the surgery costs.
Okay. Sorry, I forgot. I need to know so you have shared one thing. I want to know where are you from? Where are you from and your favorite food? I forgot about that. So where are you from and what's your favorite food? Where are you from and your favorite food?
I'm from SNS.
Which part of KL?
Orange Park,
Yeah.
Sri Kembangan.
From Sri Kembangan. Okay, what's your favorite food?
Food. Nasi lemak.
Nasi lemak lah. Okay, before I go to that, I forgot to ask you, what is your, Mr. Ong, what is your favorite, where are you from and what's your favorite food? OUG, okay.
My favorite food, those nasi.
Any Malaysian food ah? Okay. Luis?
I'm from Canberra.
Okan Road also, okay.
So favorite food. Chinese
I grew up in OUG, Jalan Ujang Mas. Yeah, Jalan Ujang Mas what? 5. My old school, Sri Mega.
Oh,
Okay. All right, cool. Next to Simon.
My name is Alex.
Alex.
SMS also. My position is IT support.
Okay. Back end, admin, tickets.
Not back end. It's on-site support. Also.
Okay.
Yeah.
All right.
So
Which?
I come from the Cameron Island.
You-
Yeah.
But where are you staying? You drive all the way,
I
or?
stay here.
Oh, okay. All right, cool. What's your favorite food?
You asked me a very good question. Right, so I thought, okay, my favorite food, no idea, anything is delicious, it's okay already.
Okay, fine. Okay, yourself, sir?
I'm from SNS as well.
Your name?
It's Isaac.
Isaac, okay.
I'm a IT person.
Same with,
I'm IT social provider.
okay, all right. Where are you from and your favorite food?
From Puchong and coffee.
Coffee is your favorite food or food?
Yeah.
Sure, okay. So you drink coffee every day as food. Okay, so yourself?
Boo.
Boo,
Yeah, Boo.
All right.
A cybersecurity pre-sales from Stanford.
Nice.
Yeah.
Cyber sales,
Yeah.
Okay. Where are you from and your favorite food?
Puchong. And my favorite food is bak kut teh.
Okay. All right.
So,
Yourself, Chong?
And so I'm Chong, or I eat carrots in the market. So everyone call me carrots, and then I'm from Ipoh actually. And then my favorite food is Ipoh bak coffee and like butter meat.
Okay. Lee Carros, your name?
Eat carrots.
ICA.
Yes.
ICA. Okay. Nice. Because Lee Carros is a Spanish name, I think. Yeah. Yourself?
from SNS, name Tiong.
Tiong,
Yeah.
Okay.
Doing
Sales. Alright. Where are you from and your favorite food?
Maru.
Taman Maluri. Okay. Taman Mida, Taman Maluri, Velocity that side lah. Okay. Your favorite food? Wow, so hard for you all to say. Okay. Alright. Whatever that's nice lah. Okay. Thank you. And yourself?
I'm Adib.
Adib.
SNS.
Your role in SNS?
Sales.
Sales also. Okay, nice. Where are you from and your favorite food?
From Subang. Wherever I can get my hands on.
Whatever. Okay. You know the funny thing is because when we do training, so usually we will ask what's your favorite food. So I find that probably it's Malaysian thing. We want to eat everything. We don't know which one is our favorite.
The question is why you ask people what's your favorite?
Just ice breaking,
I see.
Yeah, just to get to know you guys.
Related to this.
Yeah. My favorite food is ha min actually, prawn noodle. Yeah. So I must eat whenever I go to a new hawker store because I just want to see who can actually do the best prawn noodle.
So far, where is the best?
I think there's this place, Penang lah. Penang prawn noodle is the best lah. But if you ask me KL, very hard lah. But nothing can beat Penang's prawn noodle. It's just different. Yeah, it's just different, and they call it Hokkien noodle, not prawn noodle. Okay, just want to check time, All right. Okay, so let me move on. So this is the training agenda for day 1, and I'm going to show you day 1 and day 2. So day 1, I know we started a bit late. So this is what we're going to cover 5 modules today. I'm going to cover. Okay, now what you notice is that the first 3 module is actually introduction to healthcare IT, but it is important for all of you to understand a little bit about the environment of healthcare, a little bit about the technology, and we have a very important topic called clinical informatics. But you don't have to know so much about clinical informatics because it's for professionals like myself, because I do informatics, because I'm a super user. I need to talk to IT people how to build software, how to build processes, what does the processes mean. But it is good for you to understand about this module. I'm going to talk about that. And we're going to talk about analysis and design. Now, module 4 and 5 is where after we go through the basic, we will enter how to actually evaluate a system, what healthcare people are actually thinking when they want to buy a system, so that when you go into conversations, you will understand what are the things that you need to analyze before you even propose a solution. And then after that, we go to design. Design, we will cover a little bit what does it mean when you're designing a solution, like processes, why is it important, and when you have that conversation, so it is also good. So when you look at the module as well, right, you can actually now start crafting your sales pitch based on each module as well. So if you look at it later, we will go through the step by step. So I will always start with the challenges that we are facing in healthcare. Then I will start by, we are trying to use technology to solve these challenges. Then I talk about the doctors and nurses. Then I will talk about, you see where I'm going? Then I'm talking about when you are going to implement a system, this is how you should evaluate. So I follow each module at a time, but if you look at the pitch, the sales process, on how you want to talk about the healthcare solution, it is actually following the module as well. So we will go for a break after 1 hour. Then we will do. Then we go to module 2. We have a lunch break. We do a bit of energizer lah. Later you all will see. Hopefully, I'll show you what the energizer we're gonna do. All right. So every module is 1 hour. Every 1 hour we do a 20 minutes coffee or toilet break. Okay. This is day 1. At the end of day 1, later we will do a recap. Please feel free to ask me Q&A. Of course, please interrupt me as well if you have any questions that you are not familiar with. Then day 2, we are going to do 4 modules. We will start with reflection. That means I'm going to just ask all of you again what you all have learned at day 1. And then we're going to do modules 6, 7, 8, and 9. Now, if you look at module 6, selection, implementation, support, and maintenance, this is where you will consider how the healthcare customer actually is going to do selection, or how they're going to implement a solution. That means when they have chosen it already, how are they going to implement it? And then we're going to go a little bit on the IT part, testing a solution. How do you do what is white box testing? What is black box? What is blind testing? What is stress testing? And then after that, we're going to do module 8, which is privacy and security. So I'm going to talk a little bit about cybersecurity in healthcare. So those of you who are doing cyber sales, this is quite interesting. I'm going to share with you some of the case study on healthcare cybersecurity and healthcare hospitals that has been hacked as well. What are the implications? So we'll talk about that tomorrow. It's actually one of my favorite topics, privacy and security. And then lastly, we go to management and leadership. Management and leadership is basically talking about change management. So you know that every time when you implement a new system, you can't just change overnight, right? So like myself, when I try to get my parents to do internet banking, it is also very hard for them. Even though it looks so simple, you just log in with your username, password, you do a fund transfer, but it is very hard for my parents to accept it because they are not familiar with the internet banking. So I also need to go through like a, small change management in my home as well, because I need to educate my parents why is it important to do internet banking, because until today they still prefer to go to the bank, right? But how many of us go to the bank? We don't go to the bank anymore, right? So that's why module 9 is very important. We talk a little bit about management and leadership. How do we actually lead change when there's a new system or solution that is implemented? All right. Okay. So why this is important is because if you are this is actually for the benefit of everyone. The reason why such training course is important is because you can actually distinguish yourself from others. So meaning here is that when you talk healthcare solution, you are following a certain framework, you are following a certain standard. That means when you talk healthcare, when you talk about healthcare problems, when you want to pitch about providing them with a solution to solve that problem, it is based on how the healthcare IT industry has done it, rather than just, this is how people pitch, I just follow. So there is actually a certain process and certain frameworks in place. So that's one. Number 2, there's of course expand your career opportunities. So if you are doing sales today, you're doing pre-sales today. If you're doing just clinic sales, maybe as you get better, you want to do hospital sales, you want to do group hospital sales, and probably even you can actually be a subject matter expert as well. Then you probably transition from sales to pre-sales, or from pre-sales you go to sales. So you can actually expand your career opportunity based on this training as well. So what I like most is actually here, validate your knowledge, competency, and credibility. Means that if you go out and tell people that, oh, I've gone through a healthcare IT professional training, at least people know that, okay, the things that you talk about are real stuff, rather than, oh, you're just trying to, sell me something, right? So this is the benefit of it. So at the end of the day, what you will get, coming back to the objective and outcomes, you will gain the skills, and of course demonstrate your commitment towards continuous professional development. Alright, so I've gone through the module, all 9 modules. We're going to do that today and tomorrow. And we have also came across the learning objective and expectations. So before I begin, any concerns that you want to raise? Anything you want to ask me before I start? Anyone? No? Okay. Alright, I will go ahead. Alright, so at the end of this course, of course, one of my colleagues also did ask me just now whether should you go to take an exam or not after the course. You can. So when you take an exam, you will be certified as a practitioner, healthcare IT system practitioner. But again, this course doesn't guarantee you to pass it. It's just to tell you what is this course about, what are the discipline, what are the modules about. But you can study more. If you feel like you're very confident, you want to take an exam and get a certification, I can actually recommend you to take that certification. We'll talk about that later. Okay, I'll skip this. How do you study and all? We'll come to that later. Alright, okay. Why is it not moving? Alright. Okay. Okay. Alright. Here I start. Now, how many of you know what is this? Have you all seen this before? How many? You have never seen this before, huh? But if I tell you that if you all have gone to see a doctor before, they've used this on you before, you all believe this or not? Don't. So, this is how doctor listened to your lungs and heart in the year 1816. This is a stethoscope, 200 years ago. Okay, now why this is important is because this guy, he's a doctor in 200 years ago. When he discovered how to listen to a patient's heart, sound and lungs, he did not, this stethoscope thing did not come, wasn't adopted or wasn't accepted by the doctors in the community 200 years ago. Because he faced a lot of challenges. A lot of people say, what is this? What magic tool is this? This is 200 years ago. Can you imagine? People might be thinking this guy is crazy. Why suddenly? Because they used to listen to patient heart by putting the ear next to the chest. That's how the doctors do it more than 200 years ago. But over time, this is actually a good piece of technology at the time, 200 years ago. But he faced a lot of challenges trying to get the doctors to change the way they listen to patient's heart sound and lung sound. That is the stethoscope, right? So I brought this story up is because just want you to know that even as simple as something like that, you were bound to experience a lot of resistance. Okay? Now, next, I'm gonna show you a 1-minute video on the future of healthcare. I want you to take a look at the video, and at the end of this video, I will need to know what are the one takeaway that you have learned from the video. Okay, because it will then answer a lot of the questions as I get into module 1.
This is Maria. Partner, Ruben. Before their day even starts, they are providing a detailed snapshot of their health and wellness to their network. Maria slept great, but Ruben, who has a history of depression and anxiety, tossed and turned all night. Data from his neuroendocrine system shows a spike in cortisol. That may be a sign that he could be headed for a significant depressive episode. So, before he's even awake, his network has placed time in his busy schedule that day to talk with a virtual therapist about ways to reduce his stress. 20 years from now, radically interoperable data and open and secure platforms will allow consumers to own their own journey of health, providing them with a holistic, real-time view of themselves and their environment. A system in which personalized experiences that are highly tailored to one's preferences and needs are the norm, not the exception, and where care and services can be accessed quickly and seamlessly. Consumers are increasingly willing to share their personal data through wearable technology, smart appliances in the home, and even with the home itself. This vast pool of data forms the basis of their personal health profiles, so that changes or deviations can be detected and addressed immediately. This information empowers consumers to take control of their well-being in ways that were impossible in the past, whether it's proactively heading off depressive episodes for Ruben, or getting Maria her time-released antihistamine well ahead of a high-pollen day. This data also provides more opportunities than ever to glean novel insights into the health of entire communities, and to enable research and scientific breakthroughs at a rate that will only increase exponentially as technology continues to evolve and to integrate into our daily lives. Tailoring care individually based on ever-advancing capabilities to capture, interpret, and act on near-perfect data in real time is a radical change. This change will require a complete rebuild of today's healthcare system and the collaboration of several actors, some old and many new. Those with deep roots in care delivery must ask themselves how they can use data and technology to transform what well-being and care delivery means. Players in the health ecosystem will include non-traditional ones. For example, those focused on the data platforms and tools that enable this new model of health. And regulators, financiers, and intermediaries will all play a new role in this new vision. Disruptive thinking and a commitment to emerging technology are more important than ever before, because the future isn't as far off as it seems. In fact, it's at your very fingertips.
Okay, so what do you think about the future of healthcare? All right, I'll start. Just give me one takeaway from the video, each of you. What is your takeaway when you watch that compared to the healthcare system today? What do you think? Is that something that we are looking for, or do you think we are there yet? Wait, yeah. Do you think we are there yet? Spoiler. Do you think we are there yet? No, not yet. Okay. What do you think? Time saving, yeah. So one example would be your takeaway would be the takeaway from that short video would be time saving. You have any idea? What is your takeaway from that? Just that short clip. Okay, monitoring. What is your takeaway? Analytics, data analytics. What do you think? One takeaway from the video. Time saving. Yourself? You can't figure out new things, new stuff, right? Yeah. What about you?
I think we have the
Visibility, transparency. Basically, you get more information. Patient get more information. Automation. Nice. Yourself?
We are not there yet, but in the future, the doctor will be sure to come back.
Yeah, correct. In the future, make sure that you don't die. So Adib?
Healthcare is much more personalized.
More personalized, yes.
But you share the info everywhere.
sharing, you see. So you see some of the most common themes that I heard is actually time saving, and then one of it was someone mentioned analytics, which is data. This one put data. Someone mentioned automation. Someone mentioned transparency. Okay, then after that, I like this one, personalization. Okay, so you see, so what within that just one short video, you can actually see that these are all common terms. Not only healthcare, you go and do your manufacturing, same pitch, right? Time saving. You are doing automation. You are using data analytics to generate consumer insights. It's actually the same benefit when you digitize healthcare. Just that how we are going to talk about this, it's in a different way of talking about it because it involves a lot of terms like patient safety. How do we improve? How do we save doctors' time? How do we use data analytics to do someone also mentioned, make sure that the patient don't die in a hospital as well. So that is also part of analytics and data as well. So even today, when you look at the apps, we use MySejahtera a lot. So actually MySejahtera gives you a lot of transparency if you look at it. If I know many of you don't use that app anymore, the app has changed. If you open MySejahtera today, you can actually see your previous visit. If you go to a clinic before, if you have a blood result, you can actually start seeing some of those results in the app. So it is actually giving you as a patient more information to make decision on what you want to do next. Now, coming to healthcare environment, this topic is very important because I want you all to understand a little bit on how the current state is. I want you to think about your experience as well when you visit a hospital. And it is also important because you all must be able to differentiate what is the difference between a public hospital, private hospital. I know it looks, when you hear it, it's simple. Public means it's a private hospital, paying hospital. But there's a reason behind each, and the way they are funded, the way they are operating, and some of the services that they deliver as well. Now, this photo is my working place in Hospital Bentong. This is I think this is 12 years ago. More than that. I think 13 or 14 years ago. If you look at the environment, right, actually, I want to know how many of you think that situation has changed? How many? Okay, how many of you think that it's still the same actually today? Just raise your hand. Yeah. Even worse. Okay. So you look at all these files, right? As someone who was in the healthcare setting before, actually, to be very honest with you, it is actually prone to a lot of mistakes. Why I say that is because this is only one folder, But if I were to tell you that this folder and this folder and this folder is 3 different patients, it's very dangerous because sometimes you are not careful. One paper or one blood result from here can actually transfer to the other folder. It actually happened before. Because when I was going through the folder, how come another patient's blood result is actually on the other patient's folder? It happens, right? The thing is, of course, people will say, wow, if you are a very detailed person, you are a very sensitive person, you should be able to take a look at it. Why? You should not make a mistake. You cannot say that, right? Because sometimes situations can be so busy in a hospital, we hardly even look at the name of the report. We just look at the result. Oh, this patient, this bed number 5, patient John Doe and all. Then we look at the blood result. Sometimes we don't even look at the name or the IC number of the blood result. So we just look at the folder because we trust that everything that's in the patient folder belongs to the same patient, right? So it is actually prone to mistakes. And then this was me. You see, we have a computer there, but we don't use the computer. Again, it's a problem also because healthcare, when you implement IT system in a hospital, nobody uses it, right? So And if you look at it as well, it's all handwritten, and you have photos on the folder as well. Same thing, it's very, very manual. This is actually the current state of the healthcare environment today. Alright, so I just want to highlight this because it is important for all of us to understand a little bit on what is the current background. Have you guys been into this? Have you entered a medical record facility? You have not seen? Have you seen this or not? Or photos only? How many of you see photos only? Never. How many of you? Photos only. All of you? How many of you been into in the medical record? How many? None. Right. So this is the. Okay. Do you have any idea why is it color coded? Why got number?
It's different level.
Why? Okay, first of correct. So first of all, okay, so if I were to ask you, if you got 1,000 books, how are you going to label your books and put in your home library? Are you going to use number or are you going to use A to Z? Why? Are you sure? How many of you here want to use number to arrange your books? If you got 1,000 folders, how many of you prefer to use number? How many of you prefer to use alphabet? Both. You prefer both. Okay, so actually, if you again depends on what is the school of thought. Numbers are actually easier because you only have 9 variables, 0 to 9, 10 are 10 variables. If you use alphabet, it's A to Z, 26, so you need to arrange, it's very difficult. So a lot of these folders are actually based on your IC number. So they will always ask you for your, it depends how they actually arrange it. Some will immediately ask you for your last 4 digits of the IC number. They can actually go straight and figure out. So let's say if 8050, they will quickly go to, what you call that, cabinet number 8, then if it's 0, then they'll go to the next row, which is row 0. And then if it's 50, then they will go to probably level 5. And then since it's 0, probably is the first 10 of the folder. So when they go to that folder, then they will check, okay, is your name. So it's actually easier for them to do a reference. But if you do A to Z 26, of course, alphabetically you can go straight into it. But sometimes there is a patient with the same name. How many John, how many Adib, how many Abu, how many Michael, and also it's very, very difficult to determine. So it's easier to use number as identifier. But anyway, the point I'm trying to make here is this is super, it's been like this for many years. So healthcare records should be electronic already. Because even physical health record, there's a rule. I think you have to keep minimum 7 years in Malaysia. If 7 years you don't go back to the hospital, the hospital can actually discard it. And then if you come back like 10 years later, they will open a new folder for you. But there's a problem when you do this. A lot of the disease sometimes do not manifest until you become an adult. It happens. So when you go to the hospital, now worst case, this is not even you going to the same hospital. If you're going to another hospital, even if you have a long-standing record, the hospitals also don't have your previous record. So it's a challenge. So when medical records can go electronic, it becomes a lifetime medical record. Not only lifetime medical record, but if you go to different hospital, you can actually access your history directly from the medical record. So that's the benefit of digitizing healthcare. Okay, so I've skipped this. All right, so come back to basic. What is health exactly? Come back to basic. What is health by definition? Maybe I ask Icarus. What is health? Without looking at the definition.
No, I'm not looking at it, I'm thinking. So, it's to identify how good is the person is in the physically body.
Everything, correct? Yeah. So if you look at WHO definition, it's basically absent of, not only absent of disease, but it's a complete 360. So mentally, the person is okay, physically, social well-being. So it's not, Because a lot of, when people talk about health, a lot of them will be saying, hey, are you having fever? Are you having pain? So health as a definition has evolved into this general term. I mean, this is the real definition of, the actual definition of health by WHO. It's actually a complete physical, mental, and social well-being. So that's why today there's a lot of talks about work-life balance, mental health. It is actually very important to actually define the term health. Okay, now why this is important for this course is because same thing. When you talk to your healthcare customers, you want to make sure that you're talking about the same thing. Because sometimes when people talk healthcare or health, their definition might be something else. So it's also good to just clarify and get clarity from them. Now, any of you here heard of Universal Health Coverage, UHC? Have you all heard about it, UHC? So UHC is actually a system where the healthcare is actually covered by basically every population, every citizen in the country get access to healthcare. And the question is who is funding it? So typically it's funded by a system, a financial system, can be the government and all. So Malaysia, okay, how many of you think that what kind of healthcare system we have in Malaysia? Anyone? Adit? Not sure. Simon? Not sure. Sorry? No, the type of healthcare system. So you see, that's very good because suddenly when I say system, you're talking about HIS, right? So again, this is very important because when we talk about the healthcare system, again, there's private healthcare system, there's public healthcare system, insurance system. So that's why we need to be very clear when we have this communication as well. So Malaysia is hoping that we get a universal health coverage system because I think you have heard, I'm not sure whether you have read it on the newspaper, our Minister of Health trying to see that we probably can do a financing model where everybody gets access to healthcare, whether it's public or private. So we are trying to go towards that direction. How many of you have been to Taiwan? You've been to Taiwan? You've been to Taiwan? They are actually practicing universal healthcare. Because everyone, no matter who, you can go to any hospital and you only pay, I think, 10%, 20% of the total fee. The rest is all covered by the government. Because they have a national health insurance system that covers the healthcare costs. Korea also doing the same thing, South Korea. I'm trying to think of other countries. I think the UK also is using the universal health coverage as well. But of course, they tax, the government tax, but they use the tax payers' money to fund healthcare. So the definition of universal health coverage is basically, if you look at it, maybe I get one of you to read, who's the quiet one here? Okay, Boo is on the computer. I need to disturb you a bit. Boo, can you just read what the definition starting from here? What is universal health coverage? Yeah, read. Yeah, just read. Yeah.
All peoples and communities can use the promotive, preventive, curative, rehabilitative, and
Palliative
healthcare service that needs of sufficient quality to be effective, while also ensuring that the use of these services does not expose the users to financial hardship.
Exactly. You see here, do not expose the user to financial hardship. Have you heard of cases where patients go bankrupt because they are not well? Have you all heard about it? You heard about it, right? So again, why this topic is important because you need to be able to relate to some of these things that are happening. So in order for us to solve some of the financial problem in healthcare, a lot of talks are talking about implementing digital solutions to solve this kind of problem, to cut wastages, to improve efficiency so that they can bring the cost of healthcare down. So that's why it's very important to understand a bit of this concept. Okay, so if you look at what is health IT, Yeah, I come back to these fundamentals. I started off talking about medical records because I want you all to know that what is the current state. But if you then from the current state, it is important to implement IT in healthcare, and these are some of the terms that you all should know as well. So what is health information technology? So if you look at it, can we see who is the IT guy? Your IT support. So you read from here. The application. You start from here. What is health IT?
The application of information processing involving both computer hardware and software that deal with the storage, retrieval, sharing, and use of
Healthcare information.
Data and knowledge for communication and decision making.
Correct. Thank you. All right. So health IT, right? If you look at the definition, application of information processing, hardware and software combination. So some of you who are doing infrastructure, you need hardware to have sufficient capacity to deliver software that's continuously being updated and evolving, that deals with storage. See, I think these terms are all very familiar. You guys should be familiar. Storage, retrieval, sharing, use of healthcare information. So all the infra that you are implementing in healthcare system, in hospitals, these are the definition of healthcare IT. You are implementing a system where, regardless whether the end user, the patient, they can use it to store, they can use it to retrieve, and also share healthcare information. Okay? Is this definition clear? Any questions? No, so it's quite clear, right? Healthcare IT, right? So you see here, very important, so communication and decision making. Now, communication and decision making here basically means that if you have an IT solution that can actually just pass information around, maybe you end your shift already, you end your morning shift, you want to go home. Instead of passing paper and say, hey, this is my report from morning, you take the paper. All you need to do today, if you have a system, you can just click the button and tell your colleague, I'm going home now, I just send my morning report to you, please read it. And then the next question people are asked whether your colleague read it or not. But when you implement a system in place, your colleague have to actually read and acknowledge by clicking yes. You know how we do our EULA, end user license agreement, we don't read, we just scroll all the way, then click accept and click next. That is actually a very important process. So this process is also in healthcare also, because before somebody can move on and say, oh, I read already, you better make sure the doctor or the nurse read the report, because if they don't read the report, right, it's a risk. As a patient, it's a risk to you, because your blood result, not even sure whether the doctor will read it or not. So that's why in the hospital, traditionally how we are doing it is when your blood result come out, the nurse will pass to the doctor will read, okay, sign. Doctor, please sign. Because no choice, they have to show the management that, this report signed already, Sudah sign, Dr. Sudah baca. They said Dr. Sudah baca, but Dr. baca, no, we really don't know, right? That's why it's a process. So same thing also, when you implement an IT system, you are actually thinking about how can you make this process safer or better when you implement a system in the hospital. Same thing. So there is, someone mentioned HIS, I think Icarus, you mentioned HIS. HIS system, healthcare information system, is also designed where if you look at the process, when the patient register, patient take consent, next of kin when they sign, consent, everything, if you look at how all this process can be digitized, same thing. When you give a form that is electronic, you also want a process where the patient can sign on the form or tick here to agree, tick here that I have read this form, and then you can sign electronically. It's the same process, just that the process is now digital. So that is actually healthcare IT. Now, what I just mentioned is very basic. Later in Module 3, I will talk about process that involve the doctor prescribing, doctor making sure that when they send the information to the pharmacists also see the correct medication on the screen before they actually give the medication. So you see, this process gets more complicated and deeper, but everything comes to health IT. Okay, interesting, huh? All right, so I continue move on. Okay, so what is health informatics? So I've also explained. So this one I'll read. The interdisciplinary study of the design. Remember I spoke about the design of the process, development, adoption, and application of IT-based innovation in healthcare services delivery. Healthcare services delivery. Now, healthcare as a business is actually a service. They're actually providing you a healthcare service. Of course, the medication is the end product, but healthcare as a process is actually a service. The moment you walk into a hospital, you register, you wait for the nurse, you wait for the doctor, you see the doctor, you go. It's actually an end-to-end service delivery, if you look at it. Now, this end-to-end service delivery is actually part of informatics. And you can use IT to enable all these services digitally. Okay, it's a healthcare service delivery, management and planning. All right, so this is what is health informatics. Now, you also will notice that a lot of the definition, the previous two slides saw World Health Organization, how the US define it, and then even health informatics, how the US define it, is because this discipline has been championed and developed back in the United States way about 20 to 30 years ago. So all this health IT discipline, health IT software and system, it has all been developed back in the United States, and then it's being the discipline is not widely adopted in Asia or Southeast Asia, but the dream is hoping that we can bring some of this best practice from the US to Southeast Asia. Now, I want to come to the environment of healthcare, health information and technology characteristics. Now, you need to know that I think this is very common, all right? IT is forever changing. The technology last week is already old already. Every year we got new phone, and then each company is trying to catch up. Wow, last year, Generation 5, suddenly 6 months later, Gen 7 already. Sometimes you also forget what happened to Gen 6. Somebody might have passed the generation. So it's very fast. Sometimes we can't even keep up. You want to keep up with the technology also, then you must think, oh my God, should I buy next year or should I buy today? You see, so it's very, very fast, right? So it's the same also so those are your end user technology. Healthcare technology also is changing very, very fast. Although you may not see the development as rapid here, but it is actually changing very, very fast. Today we have Gen AI already. Gen AI ChatGPT is actually being implemented in HIS. So I'm not sure, how many of you here doing HIS? I mean, besides Icarus? How many of you here selling health information system, HIS system? Queue system? Ticketing system? Anyone? No. How many of you here are selling AI chips? AMD chips hardware? SNS, right? Now, they are talking about putting the AI hardware infrastructure on-prem. You see, because healthcare is very sensitive, they might not want to put it on the cloud. Even if they put it on the cloud also, they might ask for a private cloud. Or even on-premise also, you need to make sure that you are able to implement an infra that sits on the premise, and then the AI can actually run on-premise. So there are a lot of hardware now. I think AMD is doing that. I'm not sure about Intel, but I heard from AMD, their chip actually sits on the prem. You can actually train the model on-prem. So when you actually use the AI, it actually runs on-prem also. You can actually train the AI also on-prem. So healthcare, for your information, a lot of big companies are using AI now to transform the way they build their software already, their HIS. So Oracle, do you have, are you partners with Oracle? Oracle? You guys are partners with Oracle, right? If you can, take a chance, ask them, how are they using Gen AI in their software, in their ERP? Don't talk healthcare alone. You just ask them how are they using Gen AI in their ERP, then you ask them, your healthcare got Gen AI or not? The answer is got. So they are using Gen AI today to listen to conversation. So that means, let's say you go to a doctor's office, doctor asks you, how are you today? How many fever? How many days a day? Where's your pain? Got headache or not? Okay, today I'm gonna examine you. I'm gonna take your blood. I'm gonna do this test, that test. I'm gonna give you this medication. Just by talking, the AI is listening, then the doctor no need to write already. The computer will automatically populate everything in a structure form. Then the doctor just look at the output. Okay, acknowledge, sign. You see, I'm still talking about the same acknowledge process, but this kind of technology is very, very fast already. It's actually changing already. Because at the end of the day, it's all focused on meaningful use of IT to improve patient care. That's the main goal of it. Any questions before I move on? No, huh? Okay, good. So this is one of my favorite slides, because this slide summarizes the healthcare challenges in today's environment. Number one, aging population. What do I mean by aging population? In the next 5 to 10 years, 2030, 2035, the whole world, or let's take Malaysia for example, 30% of all of us are above 60 years old. Okay? And what does that mean? 60 years, as we grow older, we will start to have a lot of, we call it chronic disease, high blood pressure, diabetes, sometimes old age also difficulty walking, you got knee osteoarthritis, cannot walk, and then you need people to care. You need more than 2 people in the family to take care of you sometimes. So it is actually, if you look at it, it's a build-up issue. This is actually what is facing healthcare today. Then we talk about doctors. I'm not sure whether you all saw the paper. Doctors every day complaining not enough pay work too long on call 36 hours they're not happy. We are also facing this problem, healthcare workforce shortages and burnout. A lot of our local nurses, they go overseas to work. So because of that, we got not enough nurses also in Malaysia. It's actually not a Malaysia problem, it's actually the whole world problem. So all these issues, aging, chronic disease, burnout, is a global problem. And then we come to financial sustainability. It's getting more and more expensive. Healthcare is getting more and more expensive. How many of you here buy private insurance, private medical insurance? How many? Just show of hands. Expensive or not your premium? Getting worse, right? I remember 20 years ago, I think my premium, 50 ringgit a month. I can't remember, 50 ringgit a month. Now it's like what? 300 plus per month, 500 ringgit. Oh my, it's getting more and more expensive. And then of course there's a lot of regulation issue. Now, this regulation is very interesting because sometimes the hospital will ask you, your solution compliant one, PDPA compliant or not? Medical MDA approved or not? Your solution can one. So that's why it's a very complex environment. So healthcare, if you look at all these challenges, you need to be able to address every single challenges when it's being innovated. So if you're going to implement a solution, you're going to propose a solution, a lot of these things needs to be addressed in your solutioning. Okay, from there, this is a summary, key issues in healthcare. Everything is getting more and more expensive. And then highly variable clinical quality. Okay, this is interesting because let me ask you one question. How many of you here do doctor shopping? Got or not? No, it's okay. You can open. Just let's have an open conversation. How many of you do doctor shopping? Doctor shopping means you go to clinic A. You not satisfied with your health after 1 or 2 days. You go to another clinic. You want to get second opinion. Sometimes not happy also. You go to the third doctor. How many of you do that? Or you don't? You don't do that. Okay, because different doctors, the way they practice also different, how they are trained also different, the drug or the medicine that they give you is also different. So many brands, same group of medication, but different types. So it's very, very sophisticated. So that's why, because of variable clinical quality, it becomes more and more expensive. Insurance also will ask you why you go to 3 different hospitals before you actually get admitted. They will ask you also, you cannot claim your first 3 visits, you can only claim your admission. That's why it's very, very complex. Okay, then got patient safety issue. I'll talk about patient safety issue in a while. And then at the same time, everything needs evidence-based decision making. So a lot of the things that the doctors do when you go to a hospital, everything that you are provided, the services that you are provided, actually is all backed by evidence-based. They don't just simply give you something because the doctor think that, oh, this is normally how we do it. It's not. It's actually, most of the things are all evidence-based. And then very complex administrative issue, and then there's increased consumerism today. Increased consumerism here is, how many of you here Google your medical condition before? You all Google, right? How many of you all don't Google? You all Google your leg pain or not? You Google your headache or not? Really? You don't Google your... you guys do it, right? So because of that, trust me, the doctors are very pissed off. So we have this forum, this patient think they're so smart. Every day Google doctor. But they don't understand, this is... You guys are consumer at the end. We want to know more so that we can understand what is happening to us, so that when the doctor gives you advice, you also can make better decision, whether true or not, this thing. So that is actually very, very complex today. And a lot of maybe the hospital, depends on who you interact with. The very, very innovative one, I'm not sure, they are both spectrum. One very young one, study IT, every day do programming, very up to date. They understand these challenges. This one is consumer driven. But again, there's another spectrum where when you start to tell them about consumer, they say, no lah, consumer always wrong one. We tell them what they need. You see, but a lot of healthcare leaders and executives don't really get it much, or they don't really understand what it means by increasing consumerism, because it's getting more and more complex. So a lot of solution today that you see, healthcare solution today, is actually addressing a lot of these concerns. Okay, then advance in research and technology. Okay, then research and R&D also. R&D also is continuously increasing in healthcare, because there's a reason for that also. Because the need and the disease are ever evolving, and there's always a competition between one company to another company. They always want to compete and see who is actually doing better. Drug company do the same, IT company also do the same. That's why you guys are facing a lot of heavy competition out there. Okay, so if you look at healthcare spending, healthcare spending in the US is 5.4% of their, increasing 5.4% every year. I bring up US also because US, the whole world, is they spend the most number of money in healthcare. 1 year they spend, I think every year they spend about 25% of their GDP. That is, so I think their GDP is about 200. So imagine they spend about $2-3 trillion. I think I can't remember, I think either 2 trillion or 20 trillion. They spend that much of money, and they are not the best, highest quality healthcare in the world, Okay, when I say highest quality, doesn't mean that they are very bad. What I'm trying to say is, overall, even though they spend so much, they are not world best. They have world hospital best, but they are not world best healthcare, because a lot of them are facing financial issues, very expensive. They also have a lot of patient safety issues also in the US. So in Malaysia, we spend about, I think now it's already 5.5% of Malaysia GDP for healthcare. So private is, so if you look at the report, I forgot to throw it, but show you guys here. So government is spending about 30, I think it's 36, 38 billion now every year. Private hospital is also sharing about the same. They're also spending about close to 40 billion ringgit every year on healthcare. So this money is actually spent out of pocket for private they spend out of pocket, insurance as well. So it's actually a lot of money actually spent on healthcare. So it's actually going to increase. So if you look at besides the stock market that goes up and come down, if you go and read the healthcare expenditure report, Malaysia one, from day one until today, is the only stock market that keeps going up. You can go and check it out. Every year, the amount of budget for healthcare is actually increasing every year. Okay, then with so much money spent on healthcare, we have safety issue. Alright, so what is safety issue here is because there is an potential event of unsafe care. Unsafe care here meaning mistakes. Okay, and it's 10 leading causes of death and disability in the world. So what I'm trying to say here is sometimes there are medical conditions that are due to mistakes. Patient fall down, for example. Patient admitted, but because of a certain mishaps, fall down, and then from one small problem become a big problem. I'm not sure how many of you saw the paper yesterday released, Prince Court Medical, there's one hospital, 5.6 million got sued because patient fell down in the hospital. You guys read or not? After this break time, you just Google. So the patient was admitted, I can't remember, I think admitted for dengue, I can't remember. Fell down, became vegetable. Then they were trying to investigate, they found out that actually the fall could have been prevented. But it's a patient safety issue lah. So it became an issue, right? So it's actually a problem, okay? In high-income countries, it is estimated that 1 in every 10 patients is harmed while receiving hospital care. That means, as we are talking today, 1 patient is suffering from medical errors. Okay? Each year, 134 million adverse events occur in hospital in low and middle income country due to unsafe care. 2.6 million deaths a year. So we are trying to make sure that healthcare is safer. So these are real problems. These are problems in healthcare. So when we implement digital systems, we want to make sure that we implement a digital system that can prevent all these problems. So if you look at this, so this is a real report now. The reason I show you this book because you can actually Google this book as well. So this book was written in 1999, 2000. Every year, there is about 100,000 preventable medical death is due to human error. So if you look at the percentage, 82% of the medical mistake is due to human error. And then 18% is equipment failure. Equipment failure here means suddenly your, for example, your X-ray machine spoil, and because of that, there's delay in treatment, delay in diagnosis, and it causes a problem. But if you look at the common cause, human error is 82%. That means a lot of this issue is actually human hygiene factor that is causing the medical error. Okay, so you see here, error in the performance of an operation, procedure, or test. Have you all read about or heard supposed to cut the left leg but cut the wrong leg? Yeah, these are all errors. And why did this error occur? It's a process problem. Again, sometimes it's easy to blame like, the doctor never checked properly, why never read properly? Then if we look back, try to look at the root cause, it can be a process problem that leads to this issue. I think I have, okay. Our break, we stop the break, is it? Okay, all right. Okay, so the most common type of medication error, so medication error means you are given wrong drug, wrong dose. So if you see here, 54% of medication errors are made at the point of administration. It means when you are given the medicine, the error happens there. Why? Either wrong writing, wrong dose, doctor writes one name, but the pharmacy read another name and then give you a wrong medication. It happens. And then 21% of medication errors are made during prescribing. So, you know doctor's handwriting, right? No, this is real stuff, you know. This is real, this is real stuff. So, when, like I said, when information is passed on from one person to the other person, you lose the quality of the information. Have you all played this game called the train thoughts? So I tell you something, you pass to him, you pass to him, you pass to him, pass, come back to him. From 20 words become 2 words. You see, so it happens. So again, it's very, very important. So even if you look at the types of mistake during medication, also prescribing is also one of the highest reason. So a lot of the process, why it happens here is because a lot of the process are still manual. So when somebody write manual and then transfer to another paper, you're bound to have this kind of a mistake. Okay, so at the end, what we want to do is we want to achieve, we call it the quintuple aim of healthcare. Quintuple means 5 lah. So everything that you think about when you want to solve a healthcare problem, always remember to think about these 5 things. Does your solution improve patient safety and experience or not? You need to answer that question. That means if I'm going to propose this healthcare solution, will it improve safety and experience or not? Will it reduce doctors' mistake or not? Will it make the hospital care safer or not? Will it make the patient happier or not when you go to the hospital with that solution? So if you are selling a queue management system, for example, or a barcode printer, for example, for healthcare, you need to think whether this solution, which part of the process actually improve patient safety and experience. First one. Second one, this is a bit technical. Improve population health basically means, does it improve the outcome of the patient? Or that means if a patient goes in with a leg pain, how would your healthcare solution improve the patient's leg pain? I'm not saying that you're selling device or selling a medication, no. But how is your solution helping the doctors or helping the nurse to make their job better? Because at the end of the day, the one that benefit is the patient. So how is your solution eventually improving the patient care? So I give you one example, AI. So if I'm going to sell an Gen AI solution today, you must ask this question, what is the use case of your AI that can improve patient outcome? You use AI, do you use ChatGPT? What do you think? How AI can be used to improve you as a patient? So if you go to a hospital today, so you are a patient, how do you think Gen AI can help you? Good. How? After that? Accuracy on what? Accuracy for who? For who? Correct. See, very simple. So you use Gen AI to improve the accuracy of all the information that is collected on the computer, so that when your doctor look at it, okay, this is correct, I confirm. And when they use Gen AI, sometimes Gen AI will give the doctor things that he might not have think about also, because it's all collection of all the big data model, everything from the internet. Give it to the doctor, and then the doctor say, oh yeah, I never thought about this. Then the doctor can make better decision, give you better care as a patient, then overall improve the health of a patient. See, second one. Then the third one, how can your solution lower cost of care? I'm not talking about lowering cost of drugs, I'm talking about if you are going to implement a solution, how is your solution going to improve, going to reduce time, going to reduce wastages? So you need to think about that also. And then advancing health equity is basically access. how would your healthcare solution allow the people in the kampong or people who is living far away get access to healthcare? You also need to think about that. And then lastly, improve care team well-being. Basically, how is your solution helping your end user? Because your end user must be happy, when they use your solution. If they are not happy using your solution, they're not going to use it. It's quite bad as well, right? So remember, when you are going to propose a digital health solution, make sure that you cover five themes of the quintuple aim. Quintuple is 5 lah, quint. Alright? Okay. So if you look at health IT as a critical enabler, so if you look at the technology adoption and use as well, over time, there's actually a lot. You look at history, past 20-25 years, a lot of solution has been there. One of the earliest department to be digitized is actually the lab. So lab is actually one of the earliest department because there's so much of data. Your blood results, your kidney, your liver results, kidney results, blood results, all those kind of results needs to be stored in a database, and it needs to be easily retrievable and stored structurally. So more than 60-70 years ago, one of the earliest department to be digitized is actually the lab. Okay, and again, I've mentioned before, it's very complex. Okay, that's why it's important to understand the complexity of it. So I've also covered healthcare as well. So if you look at the types of customer as well, there is inpatient and acute care facility, public and private hospital, and then private hospital also can be considered non-profit and for-profit. So you have heard of non-profit hospital, right? Have you ever heard of non-profit? Like let's take one of the like a NKF, for example. They are non-profit organization, but they have to be sustainable. So they actually ran as a private organization, but they are non-profit lah. So that's how hospitals are being classified. So it's also important to know, because you want to make sure that when you pitch to the right customer that's having the right business model as well. Okay, then we talk about hospitals also can be also separated to different kinds of services that they provide also. General hospital, psychiatry, rehab, children, long term. Now this is important because every type of services that they provide will change how you pitch your solution as well, because you do not have a one size fit all solution for everything. Different kind of hospital that gives different kind of services, they provide different services, and your solution should be able to cater to those hospitals as well. Okay, so I think this one I will skip. Okay, so FAQ, what is a critical access hospital? Okay, so this is a very American way of emergency department. How do you get access to emergency care? So there, you call 911. Typically, they will deploy an ambulance to the site of incident. So we have similar as well. So in Malaysia, if you call 911, will put you to the emergency call center. You have to tell them where you are, and then they will actually deploy the nearest ambulance to you. The ambulance can be from the nearest hospital or can be from a nearest private hospital also. So that's why sometimes you do see private ambulance actually go to the site, but they actually bring you to government hospital. Right? Okay, so healthcare. Okay, so there is a term here, they call it outpatient or ambulatory care. Now in Malaysia, outpatient means your clinic, your GP clinic. In some other countries, they call it ambulatory care. Ambulatory, the definition of this word here, basically the patient can move. It's not an inpatient kind of a healthcare system. Right? These are just types of hospital. So this is also important for you to know, because these are just different types of healthcare system that you can actually see even in Malaysia as well. Okay, your emergency, doctor's office, even prison also got prison clinic also. The Penjara clinic also, they also have their Penjara clinic. Okay, now we see this more and more. Diagnostic services. There are healthcare organizations that only do lab only. You go to them, all they do is just lab. They take your blood, they do tests for you, and then you only come for tests only. So it's getting more today. Health screening center also, what they do is they just do the screening only. Whether they got doctor or no doctor, again, depending on their business model, but it's actually getting more today. A lot of us are moving towards the wellness part. So you will get a lot of healthcare system today that are doing only health screening. Okay. Right, then we have long-term care provider. Long-term care provider will be your, we call it assisted care lah. So like your, now it's also quite common. They call it the nursing home, community home. They actually have doctors. They actually have either they outsource their doctors or they have resident doctors and nurses in their community home as well. Are you familiar with Sunway Sanctuary? Have any of you have been to Sunway Medical Center, the one in PJ, Sunway? There's one wing, Tower D. They have a place called Sanctuary. I think it's Sanctuary, yeah. You should go and take a look. It's actually their version of long-term care. It's very high-tech. Yeah, it's a full block. New block, Tower D, I think. So if you are going to pitch a solution, you should go there. You should go there and check it out. Now, this one is very trending now because there's a need for constant monitoring. So if you got solution for wearables, solution to track where the patient walk, where the patient go, you got solution to make sure that if patient want to fall down, you can prevent them from falling down. You should go and check them out. Long-term care. It's actually a very good. It's upcoming. I think not only Sunway, but if you look at, I think Cheras also has a center where the whole building is actually a residence, but they actually have programs. I think Monday, Tuesday, Wednesday, Thursday, Friday, different programs. If you stay there, the family can actually come out and do different activity. It's actually a long-term care also, but they don't call it. They don't call it old folks home anymore lah. It's all long-term care already. They are changing the business model. They change it to long-term care. Okay, then you have integrated delivery network. So healthcare organization with a variety of providers offering services across the continuum of care. Now, integrated delivery network here will be where you as a patient, they actually send you to different hospital to get certain care. Or here got no orthopedics, you go to Kajang. Then if you are a patient in JB, they say, oh, we don't have neurosurgery here, I will send you to KL to do a certain procedure. So it's some healthcare system today, they are actually doing this because again, a different business model. They realize that there are some geographical region that has demand for certain kind of services, so they actually consolidate and put, they split these services separately. So if you need certain care, they will advise you to go to another healthcare system. Malaysia, not much. I don't see that much, but around the world, if you look at more developed countries, they are doing this already. They say, oh, you need this care, never mind. I send you to another hospital which is 2 kilometers away, but it's actually the same hospital group. Just that they do it, not only that, it's also can be joint venture and alliance also. So can be 2 different hospitals, but because they already form a joint venture and they already have an agreement, you got surgery patient sent to me, so then they will send you to that hospital. It's like a referral kind of thing, but they are integrated. Now, where is the opportunity for solutioning? This is where you can sell your data exchange, you can sell your cloud, you can sell your patient portal, mobile health. So it's actually quite rapid nowadays. Then we have this thing called continuum of care. It's a very healthcare term. Continuum of care basically means that what is the services that provide you services the moment you step into a clinic until you go to a hospital, you admit, discharge, all the way to long-term care, home care, community care. So this is actually a concept now where everyone wants to be able to promote a continuity of care services. So that means the patient don't have to worry. The patient can actually get care from the beginning until the end. Okay, the next term would be goals. Okay, so I've touched this before. Remember your quintuple aim of healthcare. At the end, it has to come to better care, safer care, and less costly to reduce the overall cost of healthcare. And then how to enable all that? You need healthcare IT. So healthcare IT, digital health solutions will be able to enable and help solve some of these problems. Okay, then of course you have role of government. I've also covered this. Government, when I spoke about who's the payer, taxpayers' money, universal healthcare, can be both public and private funded. Payer as well, can be insurance, private insurance will pay. Some countries, they will have a national health insurance. And then of course regulation is very strict as well. Whether your medical solution, medical device is certified or not, whether is it approved or not. So these are all the roles of the complexity of the healthcare system. All right, so if you look at the billing as well, now I spoke about this as well. So if you are selling to a CFO, you also need to understand their concern as well. Whether your solution can capture patient charges or not from the beginning until the end. Patient admit already, charge. Patient fill in one form, charge. Patient press the bell, charge. Doctor say something, charge. Right, go to the toilet, charge. So it's also very important to be able to talk about this when you're when you're selling your solutions. Okay, so we have this thing called coding, claim processing. Now it's very insurance company, everybody will ask how can do integration. Then hospital will ask you, hey, I want to push my claim straight to insurance company, can you automate that or not? So it is quite it's quite a complex conversation. Then coding, if you Malaysia one, you follow the Schedule 13. So Schedule 13 is a schedule by MMC where you can see each procedure how much maximum the doctor can charge. You all can check it out. We call it the Schedule 13. You go to Google, you type Schedule 13 MMC. You can actually download the whole PDF. You can see how much doctor charge you for removing appendix. You can see how much. So these are all regulated stuff. So again, they will also ask you whether you can integrate this kind of content and bill into my system or not. Then after that, final billing. Oh, I want my patient to discharge fast. I want my patient to go home first. Can you give the final bill tonight or not? So patient can pay at home. Or maybe patient pay 10% first, go home first, settle the bill later. So again, these are all some of the solutions that you need to be able to address for your customer. So again, payers here, again, I spoke about both. Private financing, public financing, national health insurance, national health system, different reimbursement model as well. Now reimbursement model here again depends. Some only cover outpatient, some only cover admission, some only cover wellness, some don't cover anything at all until until something bad happened to you. So you also need to be. These are some of the things that we spoke about. Publicly financed, different models. So UK has a different model. Canada has so both UK and Canada share. They have a national health services system. US different. They have Medicaid, Medicaid, open market. Every day they are fighting on price of healthcare insurance, private insurance, and all. So it's very interesting to see how different countries do it. So Malaysia, we are very straightforward, public and private. Public, you just go to the hospital. If the things are not available in government hospital, you probably have to pay out of pocket. Like some of the implants, some of the drugs that are not approved, maybe you need to pay out of pocket. And then private healthcare, very straightforward. Either you pay using your insurance or you pay out of pocket for private healthcare. That's for Malaysia. Alright, so again, privately financed also depends if your boss, if your employer pays for your healthcare. So typically there will be a corporate insurance package. So if you get admitted, it will be paid it will be paid by the insurance. Okay, so I think I've covered most of this. Interregional healthcare organization support purposes. Okay, I've covered this. Comprehensive care, effective transfer of care, portability of care. Now, portability of care basically, how portable is it for you to deliver the care? Either it's mobile care, whether is it convenient for the patient to move from one healthcare facility to another now to receive care. Okay, then I move healthcare workforce. There's so many different stakeholders here, so many different personas. Physician or your provider. Physician and provider here basically means the people who provide care. Your doctors, nurses, pharmacists, dietitian, physiotherapists. And then you have all the back end office, the clinical support people, administrator, financial back office, IT people. Right. So, and then of course, different senior roles of health IT information professional. You got your CIO, CTO, CSO. Now, Malaysia, I think now only slowly you start to see hospitals are having CIO. CTO maybe in big different kind of a technology company, but in hospital not much yet. You see a lot of CIO and head of IT only, or director of IT. Actually, there is a difference. Some people will ask, what's the difference of CIO, CTO? Because these terms has been defined very specifically, mostly in the US. CIO has a very specific role. The CIO's role is to make sure that they take care of the information. They as a chief information officer, they take care of everything that got to do with the information infrastructure and processes. CTO, they only take care of all the technology related, but they have synergy in between. Some people, they can be both CTO and CIO at the same time. So again, depending on the organization structure. CSO, I'm very certain that there's no hospital in Malaysia got chief security officer. A lot of them are being managed by IT. Either IT manager or head of IT is doing security. Okay, now these two things is not common here. It's very common in Singapore. Singapore actually adopted the US standard. They actually have chief medical and chief nursing information officer. So these are doctors and nurses, they are IT nurses and IT doctors. So they work very closely with the IT people to do IT in healthcare, in their hospitals. Okay, so these are the IT department responsibility. I just want to go quickly because I think I've covered most of it. So some of you who are in IT, I think you're already familiar with this. So you do operation, technical support, information security, website development, telecommunication, desktop support. So just remember that your role is also evolving. So if you are in a healthcare organization, your role also will start to evolve. Because these are very, I would say, basic stuff that you should know already, but as time goes by in healthcare organization, your role as a IT support will start to change also. You will start to think about how can I actually support my doctors and nurses to make their job easier as an IT department. Okay, so these are some of the common IT positions that you can see in healthcare organization. Again, this is good for you to know because ultimately it will form the structure when you are implementing a project, when you are talking to different stakeholders. You must also understand what are the needs of your CIO. So your CIO will ask you some of these questions as well. Who's going to help me do some of this stuff? Whether do I need a project manager for this or not? Do I need a security analyst for this or not? Because eventually when you sell a solution, they will want to know as well, who do you think in my team that I need to bring in to make sure this project is successful? So good for you to know. Okay, healthcare providers, again, subject to regulation, license, accreditation, certification. So this is also, just to let you know that if you look at regulation, an interpretation of law that is written by responsible regulatory agency means that your healthcare provider, your doctors, nurses, they're actually regulated. Not everybody can just provide care. They are actually regulated by agencies, like your Malaysian Medical Council. Make sure that your doctors and nurses are registered before they can actually provide healthcare services. So again, this is for good for you to know basis so that you understand the concept of healthcare regulation. Then you have different regulation agencies. Forgot to add the Malaysia one in, but these are some of the common familiar names. You can see if the US, they have FDA, OSHA. Malaysia also the same. Malaysia we have MDA, we have OSHA as well. And then we have Malaysia MOH as a regulator as well. So these are some of the regulatory agencies that we need to know what's happening. So I think cybersecurity, NASCA, I think Malaysia is NASCA, right? Malaysia, yeah. They are also now a regulatory agency that will regulate how healthcare is going to deliver IT services without compromising on cybersecurity. So it's actually part of one of the essential services already. So again, license. So this is also for you to know basis, difference between regulation, difference between license. If you got no license to conduct any activity or you have no license to provide any services, you are not allowed to do it. So against the law as well lah. So there's actually requirements. These are all, so like doctor, for example, if the doctor is not licensed to provide care, if you report, the doctor can actually get into trouble. Even the let's say a hospital or clinic, you notice that the clinic is not licensed to operate, you can also file a report. It's also part of legal will come and take action as well. Okay, so credentialing and privileges. So have you all heard of these terms before, credentialing and privileges? Okay, so credentialing and privileges basically means that you want to make sure that that person who is conducting a procedure or activity is actually credentialed. And how do you make sure that that person is credentialed? Usually there's a process. They need to fill in logbooks. So let's say, for example, injection. If the doctor is going to do an injection on you, typically there's a process where the doctor has done like 100 injections a year. And then they are given a credential and say that this doctor is actually privileged and credentialed to perform injection. This is just one example. So it is also very important because you will hear this often as well in your processes as well. I just want to end this quickly. So process of granting recognition to an institution, just accreditation. Have you all heard of things like ISO standards, IEEE, JCI standards? These are all accreditation body. So the reason why they give accreditation to these hospitals is to let people know that this hospital actually comply to certain standards. That's the accreditation. Okay, then certification, this is just one example. Certification is basically recognize that someone has actually met a certain standard as well. So like today, end of tomorrow, once you complete this training, all of you are actually competent at a certain level of understanding what is health IT and digital health, and then you can actually take an exam, and then once you take the exam, you pass it, you become a certified associate in health information management system. So this is just one of the definition of certification. Okay, I'll give you a summary now. Okay, so network of healthcare environment summary. So I spoke about network of public and private providers. I spoke about delivered in a host of location paid by both public and private. I spoke about both different systems, public and private. I also spoke about regulation. So government and government will actually be involved in regulation and healthcare services. And then from here, before I end, the first module, this is only first module, it's a big module. How many people do we have? 2, 4, 6, 8, 10. Okay, I'm just gonna, no time really.
Go, until 12.
Okay, so I'm gonna do this very quickly. I'll just split the group into two. I just want to know a little bit. Just answer this question very quickly. I give you all 3 minutes just to discuss among yourself. I want you to name one hospital or hospital group that you know. I want you to explain whether you are talking about a private hospital or public hospital, what type of hospital or services that they provide, whether is it orthopedic center, whether is it tertiary center, and what is your experience with the hospital. Maybe I want to, just one of you, I just want one of you to share a bit, and how do you think the hospital can be better. Okay, so I just let you all discuss. Just you can turn facing this table. You all can just discuss very quickly, just 3 minutes. After we've done this exercise, we can go for a break. Yeah, just 6 of you, and then 4 of you. So I just give you all 3 minutes, just a very quick exercise. 3 minutes, just discuss. Think about one hospital that you have been. Discuss a little bit. Just answer 5 questions. Then I will get you all to discuss about it. Then I just want to, because the reason why I do this is I want to gauge your understanding, whether you all have learned anything from the lecture or not. Okay, 3 minutes starts now. Pick a leader. Yeah, pick a leader. 3 minutes, very quickly. Yeah. No, pick one. Pick one. Pick one.
From general surgeon, orthopedic, basically cancer, general any topic. Have a cancer doctor, surgeon.
Okay, 1 minute. Talk about your experience and how you think the hospital can do better. As outpatient also can. Yeah, talk about your experience as outpatient. What do you think? Or if you have heard stories from your friends or family about their experience.
Have to get insurance approved on UK.
Okay, write it down. Later, I'll get one of you to present. 30 seconds.
Thanks, Tim.
They have your emergency services, then with your
After this, we go for lunch. If I'm not mistaken. Yeah. 11:50. Because we start 1 hour late.
As long as we understand.
bilik beranak.
Since you are the one present.
Okay, we start.
Okay, 5 seconds. 4,
3, 2, 1.
3,
What's the experience?
2.
Just want to go for that.
Okay, finish. Okay, you all start first.
Money is public, private company.
You all finish already, yeah?
Consider so money matters. So no money, no coming.
Yes.
No money, no money.
And then it's 3 days. Call you, hey, you need to pay the money already.
Okay. Never mind, I let this group start first. Who wants to talk? I think you can sit here. You don't want to go in front. You can. Okay. You tell me. Okay, never mind. So finish. Finish. Okay, we let this group start first. Okay, you just answer some of this question. Name the hospital that y'all were discussing. Talk a little bit about the types of the hospital, whether it's public or private, and then what do they provide? What is your experience, and how do you think the hospital can do better?
No need lah.
Okay.
So good. Subang Hospital.
Subang, which one? SGMC.
Shah Alam.
Shah Alam. Okay.
Shah Alam Hospital is a public hospital.
Government one lah. Okay.
Water hospital is general hospital.
General hospital. Okay.
Everything on right.
Okay.
Pretty much covered.
Have you been there in the hospital, you guys, as a patient?
As a patient, I'm just visiting somebody actually.
What is your experience?
It's packed. It's packed. The thing is, when we are talking about hospital, especially when we are talking about general hospital. Let's say, for example, we are talking about Shah Alam Hospital and Plum Hospital. The Shah Alam Hospital should be covering Shah Alam residents, right?
Okay.
People around Shah Alam, but they are also covering for people in Plum. Because
Okay.
Plum is so packed, they have to transfer some of the patients to
Shah Alam.
So if let's say how we can make it better is we need more funding to get more hospitals.
Man, this hospital manual or what? Shah Alam?
Shah Alam is basically manual.
Yes.
It's manual. There's a lot of people manual, still manual, and I don't get to see any.
So do you think if they invest in IT, they can be better?
Then again, it's a government hospital, right?
Yeah.
So yeah, they can invest, but it's going back to the government.
Okay. Their registration is manual also.
Correct.
Really?
Type it on the computer lah.
So it's a bit semi-digital lah. Okay.
Semi-digital. Pernah datang belum?
Okay.
Bayar RM1.
Okay, still very manual lah. Okay, so you all do private, right? Okay, so I talk about government first. So government hospital, a bit of background. They have quite a legacy computer system lah. So a lot of the functionality only allows them to do basic administration, registration. Some do not allow them to type medical records, medical notes on the computer system. Still very basic, rudimentary. So actually, yes, they can be better, and if they implement a full-fledged system that allows, like you said, population to register online, make appointment online, so that it doesn't get so crowded. Yeah, so there is such solution out there. I think if you look at My Sejahtera app, you open it, you can actually make appointment, dental clinic, clinic kesihatan. Yeah, nobody talks about it, right? Yeah. Okay, so this group took government hospital, Shah Alam, and they think that it's so manual, but can be improved if they get more funding and implement an IT system and solution. Okay, this group, which hospital you all chose?
KBJ.
KBJ.
Yeah, the KBJ is a private organized.
Okay.
Right? And what type of hospital? The hospital also have a provide the emergency service and then outdoor treat, right?
Outdoor patient.
Orthopedic, outpatient.
General surgeon.
General surgeon, specialist, cancer, like surgeon like that lah. Okay, have a many service in the
Okay.
KBJ. It's a
Okay. And
And
then,
then what is the experience with the hospital? Experience.
which one? Which KBJ?
Which KBJ?
They do not have a central system, so even you visit different KPJ,
Good point.
have to register different many times.
Good point.
How can they be better? Invest HIMSS.
Exactly. So yes, you brought up a very good point. So this group chose KPJ group. Perfect example. So it's a private hospital. They got 33 hospital now, I think 30 plus hospital. You brought up a very good point. So even though it belongs to the same KPJ group, right, their IT system don't talk to one another. It's super challenging. So imagine, let's take Facebook as an example lah. You go to Johor, you open your Facebook. I only can see Johor stuff. Then you go to travel, let's say you go Taiwan, you open Facebook. How come I only can see Taiwan stuff? Malaysia stuff cannot see it. You cannot see your Malaysia friend already. So imagine this kind of experience. Will you still use Facebook? You won't, right? Yeah. So same also as a patient. If I go to a hospital group, my record is only available in one hospital. Then the doctor say, let's say KPJ Johor ask me to go to KPJ KL. Okay, you go to KPJ KL. Then you go all the way to KPJ KL. Your KPJ Johor ask me to come. Okay, where's your IC? Register again, fill up the form. Fill up the same thing. Name lah, your IC number lah, home address lah, next of kin lah.
Actually, government also is the same.
Correct. So government hospitals also having the same issue.
It's the same issue.
So because of this, actually a lot of wastages. That's only one part. Now imagine everything that has been recorded in Johor, KPJ, is not captured in the KPJ KL. Let's say got a very sensitive information, you're allergic, forgot to transfer lah. Let's say even as a patient, sometimes you also forgot. Sometimes the doctor will ask you allergy cannot remember already. At the moment you cannot remember, right? But actually you are allergic to something documented in Johor. You forgot to tell the doctor. Then doctor give you something accidentally that you are allergic to. Oh my god, I'm having allergic now. It's a safety issue. It is a safety issue. And then it's the whole convenience, the continuity of care thing lah. So it's really a real issue. This is actually happening in our healthcare environment today. So a lot of these healthcare systems are not integrated in terms of technology. So that's why there's so many disconnect components. Information not exchanging lah. Don't talk about information not exchanging. A lot of the IT department, they are struggling to understand how to govern their health data also. That means the CIO will struggle, probably thinking that, okay, now I got 5 hospitals. How do I make sure that I write a proper policy in place so that 5 of my hospitals can share information? It's not widely spoken about in healthcare, but it's really a real challenge. So organization, I know you all sell to enterprise as well. So imagine you sell to Apple or MSI or Nvidia or AMD, they will tell you that, oh, the email address, imagine I send you an email address, then I say, you got receive the email, oh, that one Taiwanese email cannot receive. The email, that means when you send a request to a global department, they say, I cannot receive because it's a different domain. It's a different email server. It doesn't make sense, right? Yeah, so actually it can be implemented in healthcare. Healthcare organization can actually sit on a single database and a single server, but the adoption is very, very low because of a lot of the challenges. When you say costing, again, I don't agree, because when you scale the data center, it gets cheaper, correct or not? So I think there's a lot of resistance in the strategy. A lot of the healthcare organization, they don't have the digital strategy to actually implement this. So your role as a principal, your role as a technology provider, it is very important to help the CIO and the CTO understand that it is very important to have a healthcare system that has data sharing and integration. A lot of them, they don't talk about it. The experience on this healthcare integration also is not much in the healthcare environment. That's why it's very, very difficult for them to actually implement this. Technology is there. You guys are selling all this infra stuff, you know it's there, can be done, switch on, only the button, but to implement it in the healthcare system is very, very difficult. So I spoke to a hospital CEO before. They told me that hospital don't want to share because they are competing. I want to see whose P&L is better, same group. See, but that is not the right conversation that we want them to have, you see. Because at the end of the day, if you are a patient, you want to travel from hospital, let's say from one Gleneagles to another Gleneagles, for example. The P&L is there. I mean, as a patient, you want to make sure that you get good care from one Gleneagle to the other Gleneagle. But that technology is not implemented. It becomes very, very difficult as a patient. So again, technology is there, but I think the understanding on the importance of having integrated IT system in the hospital is not there, and it's very poorly understood. People talk about cybersecurity. They will say, oh, I do on-prem, offline, so I cannot get hacked. True? Is it true? Are you sure? Cannot be, right? Because one of your staff would also go online to do a bit of Googling. If you have a potential protocol or there's a potential backdoor that can enter the system, you still get hacked. You see, so this is real story now. I've spoken to one of the CIO. They told me that we do not want the hospital group to integrate because we want to reduce the risk of cybersecurity. Doesn't make sense. You see, some people said, oh, I only do local intranet. I don't do sharing. I don't go to the cloud. I want to prevent hacking. So sometimes I question, is that the right conversation or not? So I think it is very important for all of us, technology providers. You need to help them understand the implication, the benefit of integrating hospitals together, benefit to the patient, benefit to the healthcare operation, so that they understand, why is it important to have it integrated. Otherwise, they'll give you stories that you know that it is not true, but it's very hard to rebuttal that point. I don't want to integrate because I want to reduce cybersecurity risk. For me, it's not a credible excuse to say I do not want to have integration because I want to reduce cybersecurity risk. Doesn't make sense. In ICU today, there's so many medical devices. Your pump, blood pressure monitor, your monitor, the one that see your ECG, the heart rate and all. These are all IoT devices. It's connected on a certain Ethernet protocol. Will you get hacked? Eventually gonna get hacked. It's just when only. Right? So that's why it is very important. So if you are selling cybersecurity, the endpoint user devices is also a component where hackers will actually hack the hospital. It's very, very not famously talked about, but it is something that is actually happening even without us knowing. Okay, all right. I think we can. It's lunchtime, is it?
12.
Lunchtime, right?
Start at 12.
Yeah. Okay. We have 5 minutes. I'll go through this quickly. You have any questions? No? Okay, let's do a Q&A very quickly. Number 1, patient who engage with their healthcare provider. Live longer. Anyone else? Agree? Experience better clinical outcomes. Who else? A. Correct. Okay. Alright. Okay, so if you look at the answer, right? Tricky, but actually you must know what is the purpose actually. Right? Okay. Alright. So question number 2. Outpatient provider include. Remember, outpatient, what does it mean? Means you don't get admitted. So which one is this? Which one? A and B. Anyone else? Correct, it's all of the above. Yeah. So outpatient basically means all this. So ambulatory, like I said, day surgery. So you've been to centers where they do scope, you can go home. That one is ambulatory. Emergency will be emergency. You go emergency, you do some stitching, you go back home. Community health clinic would be your clinic kesihatan. You go to the clinic, any of your private clinic as well is considered outpatient, all of the above. Okay. European healthcare system ensures that, I should have changed it to Malaysia healthcare system, but if you look at European healthcare system, what do they ensure? Remember I told you about the 5 things? So if you look at the answer here, what do you think is the perfect best answer for this? C? C? Correct. So you are talking about access to basic healthcare. So all healthcare systems should make sure that their citizen can get access to basic healthcare. Okay? Alright, which plan is not part of managed care plan now? Remember this one is US centric, but let me help you answer this. So it's not part of managed care plan. So in the US you have Medicaid, Medicaid, and then they have HMOs, they have co-payers, payment and all. So how to say this Medicare, Medicaid is not part of their managed care plan. So their managed care plan is different. They got insurance certain level as well. So this one probably not relevant to y'all, but just to give you an example. Okay, the cost of health insurance is influenced by all of the above, correct? Okay, private insurance is regulated by C? Regulation, remember? State and federal laws. Yeah, remember regulation, government usually will do it.
But for Malaysia, is it private and public also?
Private insurance is also regulated by it's also regulated by government also, because the fees is actually regulated by the PHFSA Act, the Private Healthcare Insurance Facility Act, which is the person who signed off is actually MOH. The PHFSA Act, Private Healthcare Facility Act. Coding is part of the, okay, remember coding? When I say coding, not your Python and your C, coding here is your medical coding, your database, your content database, structure template, structure document, certain procedure got certain SKU number, certain code. So this is part of what cycle?
Software design.
Anyone else? B. Okay. Huh? Why D? Who say D just now? Who said D? No, D correct. Because you need it for finance. Finance will, you capture your code, you capture your procedure, you capture your registration, all coding one. You capture your services also, it's all coding. Alright, so number 8, the what determine what hospital will be paid for all acute care. Wow, you know, huh? Correct. DRG, those who are not familiar, it stands for disease related group. So disease related group basically means if you are diabetes as a group already has a standard how much, what is the procedure you need to do, the doctor need to do, hospital need to give, what medication by right supposed to give you as part of that group. So they need this group because this group will kind of give you an estimate how much your medical bill will cost at the end of the day. So DRG, okay, DRG, if you go to MOH, there's a department called case mix department. You talk to them, they are doing DRG, but it's not implemented in private healthcare because it's very difficult to implement. IT, they need IT help because if you use IT properly in the hospital, you can use the DRG group. Any hospital can capture the charges very specifically, and then you can use the DRG group to specify how much each procedure will cost, how much each disease will cost, how much the surgery will cost, and all the drug, how much it will cost also. This is good to control costs in healthcare. Okay, so I think we will skip the coffee break. We'll go straight for lunch. Okay, we started 1 hour late. All right, any question? I know it's a long topic, but do you guys get anything out of it?
Or do you
Good,
want to ask any others questions that are related to your current customer situation? Also feel free to get a voice.
Yeah, please ask. Let's go for lunch after this, and we can have the conversation. Okay? Yes, everyone good?
Yes.
All right. Thank you. We meet after lunch.